Hi, welcome to What's Happening at Tri-City Medical Center. With us is Dr. Adib, a board-certified OB-GYN practicing at Tri-City Medical Center. She is here today to talk about women's health and urinary incontinence. Welcome, Dr. Adib.
Thank you, Kelly, and thank you for having me here today.
Well, first question, what are some of the reasons for leaky urine?
Yeah, there are multiple factors into play. And the first and foremost factor is aging, of course. The second one is childbearing. People who had many kids and larger kids and pushed longer time for their delivery, they're more prone to have a sagged bladder and leaking of the urine. Also, genetics plays a very important role. I've had ladies who had only one kid with 3 degrees of sagged bladder versus another woman with a better and a stronger connective tissue genetically, and they have 1 degree of sagging of the bladder. So these are the main factors into play. But of course, there are some underlying medical conditions for the patient that make them more prone to get a sagged bladder and leak urine. Like if someone has COPD and they cough all the time, with each coughing, they sag down more and they kind of make it more prone to happen faster. It just accelerates it. It happens anyways with age. We are upright situation in like about 16 days of 16 hours in 24 hours. So gravity pulls it down all the time as we age. But another predisposing factor is when people are overweight. Obesity itself and overweight pushes it down more than it would normally get by aging.
So older women are more prone because of, I don't want to say gravity, but just because of what? Why are they more prone again? Let me just
because just the time passes,
okay.
And as time passes, as we age, our connective tissue sags down anyways, and also the gravity works on our organs constantly when we are in the upright position. So as we age more, there are more hours that our pelvic contents are exposed to that gravity.
Now, I heard, goes back to all these things you hear and then you get on the internet, is it true, is it true? I heard that you can use sit-ups or they encourage you to do sit-ups as a woman to help not just your back to help carry you, but also help with your bladder. Is that true?
I believe you mean Kegel exercises, Kelly. And if the degree of sagging or leakage is minimal to moderate, Kegel exercises may work. So the way women can do Kegel exercises is to constrict their inner muscles. And just imagine if someone is sitting on a toilet and voiding, and the exact muscles that will stop the voiding are the exact muscles that women need to contract to do Kegel exercises. So they can do 30 sets in the morning, 30 sets in the afternoon, hold it like 2 or 3 minutes, release 1 second, hold it again 3 more seconds and release. So 30 sets. And it may work in, as I said, mild, but higher degrees of sagging or leakage, probably Kegel will not work.
So, and you're saying it helps with urine leaking, but I guess it would help strengthen as well the vaginal walls as well?
Absolutely. It kinds of tones up all the pelvic muscles, and it's helpful in general.
Okay. And so this was one of the things that can be done, certainly. What else can be done to help with this urine leakage?
The first thing would be to avoid all the conditions that will accelerate the process. Like if someone has a job that is involved with heavy lifting all day long, they're more prone. So if there's a way to do that less often, I know it's easier said than done, but that will help to have this problem later in life rather than sooner. Also, constipation is another correctable factor. If people are constipated, and just the small stool softeners will delay this process. Of course, we can't do anything for aging, but there are two different kinds of, actually there are 5 different types of urinary incontinence, to be more exact, but the most 2 commons that most of women get it is stress urinary incontinence, which happens with laughing, jumping, or like change of position. And the other one is urge incontinence. That has nothing to do with positional cough, laugh, sneeze thing. That's just an urge to pee, and women may even have accidents if they don't get to the bathroom soon enough. So for each underlying reason, there's a different treatment. Like for urge, Kegel exercises will not really work. So a doctor will exactly determine, after interviewing and examining the patient, what type of incontinence is involved and what is the best way to deal with it.
So something like, this bladder sling or a mesh in treatment, what are those things, and are those kinds of things the items that you would use for a more, I don't know if the word is severe case of urine leakage?
Absolutely. They are very, very helpful modalities that we got them recently. And I want to use this opportunity to inform all ladies, because I'm sure we all have seen advertisement on TV. If you've been injured by this mesh or such and such, call us. So it's a common misconception, I want to say, that the meshes are not good. But in good trained hands, they really can change the quality of a woman's life. For higher degrees of leakage, if it's due to sagging of the bladder or the bladder neck, the best thing to do is a bladder sling to hold it up. We used to do that with stitches only. And in the best trained surgical hands, the dissolvable stitches would kind of dissolve, and women were in square one within 7 to 10 days with the best, exactly. But the mesh is made of propylene, and it's not dissolvable, and it's made like fenestrated. It has holes in it, and the patient's connective tissue grows in between the pores in the mesh, and it somehow intervenes, and it makes such a strong support for the bladder that it's life-lasting. So in good trained hands, it's really a good modality, and I want women to talk about this to their doctors. It's just like about saying that cars are not good. Yes, in 2014, about 33,000 people died of car accidents, but it doesn't mean that we shouldn't be driving. We shouldn't go to driving classes. Same thing, meshes, if used in trained hands, and the candidates are the right candidates, it's really, really helpful, and it's really changes the quality of life.
So bladder slings and mesh, this is something that you personally do in your practice?
I sure do.
Okay. Thank you, doctor. And if you want further information on women's health at Tri-City Medical Center, please visit tricitymed.org.